So go long on masks. There's nothing more important. The CDC said so. But of course, our politicians didn't need to hear that. They already believed it. Earlier this month, California's Governor Gavin Newsom sent a tweet from his office with this command, quote, "Going out to eat with members of your household this weekend? Don't forget to keep your mask on in between bites. Do your part to keep those around you healthy. Understand? You're eating with people you live with every day, but be certain to shield your faces as you eat for safety." That tweet is still up, by the way. They weren't kidding. Watch Newsom's fellow governor, Andrew Cuomo, the man who probably killed more Americans from coronavirus than anyone apart from the Chinese government. He explained that if you don't wear a mask, you're a murderer.
I think it's disrespectful of people not to wear masks. I mean, think about it. Do I think local government should be enforcing it? And should there be sanctions? Yes. Yes. Because it is a public health emergency. And I think there should be a penalty. Because you could literally kill someone. You could literally kill someone because you didn't want to wear a mask.
You could literally kill someone. Literally, he said it twice. You selfishly wanted to breathe fresh air and conduct a human conversation. You are John Wayne Gacy. In Nashville, one city councilwoman suggested that citizens who don't wear masks could be charged with attempted murder.
You know, I work for an organization that if they pass a virus, then they are tried for murder or attempted murder if they are not told. Maybe there needs to be stronger legislation to say that if you do not wear a mask and you subject exposure of this virus to someone else, then there will be some stronger penalty as it is in other viruses that are exposed.
So you thought you were smiling at someone you love. In fact, you were pulling the trigger. See you in jail, miscreant. Harsh words, but then science itself is harsh. Science has no regard for sentiment or public opinion. Science doesn't care about your feelings. Science is about facts, data, truth, measurable outcomes. So what is the science on masks? Well, as it happened, we have the latest for you tonight. And the science comes, interestingly, from the CDC, whose director has told you that masks were magic, more effective than vaccines. But the numbers from the CDC suggest otherwise. A new study conducted by 11 medical institutions analyzed a group of people who tested positive for COVID during the month of July. Here's the interesting part. Among those who were infected, more than 70% reported that they had, quote, always worn a mask for the preceding 14 days. Another 14.4% said they had, quote, often worn a mask. In other words, almost everyone, 85%, who got the coronavirus in July was wearing a mask, and they were infected anyway. So clearly this doesn't work the way they tell us it works. Clearly someone's been lying to us, many people actually. How did this happen? Well, the short answer is we're not sure how so many people got the coronavirus while wearing masks. But there are clues that our leaders appear to be ignoring. Here's one. According to a study published in April by researchers at several medical institutions, including Cleveland Clinic, surgical masks are actually ineffective at stopping the inhalation of small airborne particles. Instead, the researchers found that surgical masks, which almost everyone is using to protect themselves from the coronavirus and not murder other people, are actually only useful from protecting users from, quote, large droplets and sprays. That's not how the coronavirus spreads. According to a letter signed by several researchers earlier this month in Science magazine, the biggest threat from the coronavirus, quote, by far, is when it's contained in small particles that can easily bypass face masks in aerosol form. Droplets quickly fall to the ground, but aerosol lingers. The researchers wrote that the tiny particles can remain in the air, quote, for many seconds to hours like smoke and be inhaled. The particles are, quote, highly concentrated near an infected person, but aerosols containing infectious viruses can also travel more than 6 feet and accumulate in poorly ventilated indoor air, leading to super spreading of.
Yeah.